Hi, everybody. Thank you very much for coming today. Today, not to mention, I have this really cool mic on so I'm going to be your motivational speaker so that you can learn as much as possible about why physical therapy in particular, but physical activity, why it's so important for our health. And I have, if you have some time if you have any questions, just let me know. I can answer those surely at the end of our session today. So what is physical therapy? Many of you may have had physical therapy before, maybe you haven't. Maybe you know some friends and family or other loved ones that maybe have had physical therapy before. But let me tell you a little bit about what it is. It's the process to establish, restore, or maintain maximal movement and functional ability throughout the lifespan. So basically, we want to help you be as independent as possible with all of your functional, social, and recreational activities. We want you to be able to do those things as best as you can throughout your entire lifespan. Physical therapists treat people at neonatal stages all the way up through the lifespan, even past 100. Okay, we can see anyone. So a physical therapist's role is blending science with inspiration. We teach you how to prevent or manage a health condition and help motivate you during your treatment so you can function optimally. Okay, we're going to be your coach, but also help you be able to learn what you need to do to continue to be able to be as healthy as possible. So we would help you through with those activities and then teach you a home exercise program and take a look at those with your goals and help you be as functional and independent as possible and safe. So what can a PT do for you? First, we're going to evaluate and treat any mobility and walking difficulty. So there are tons of different types of physical therapists. The ones that we're going to focus on today are what our branch does here at the Cleveland Clinic. What we would do is evaluate you for any fall risk. And we'd also ask you, what type of difficulties are you having with your everyday activities? We can also help you improve your balance, your strength, and your endurance. We'll help treat any difficulties that you may have with bed mobility, car transfers, any other recreational activities, maybe golfing, bowling, or being able to get out to your ladies group or your men's group to be able, or work with your church, any other type of physical or recreational activities that you enjoy. We also want to educate caregivers to be able to teach different techniques to their loved ones or our patients and clients that we see here so that you can carry over techniques and help those things be a little bit easier for you to do at home. We also will recommend and teach the use of appropriate adaptive equipment, so that would be canes and walkers, and also power chairs, power mobilities, scooters, and wheelchairs. And then we can also make recommendations to occupational therapy, which is OT, speech language pathology or speech therapy, social services, and then also the power mobility evaluations, and any type of brace fitting to like an orthotist or a prosthetist if someone needed a little bit of assistance to help lift their foot for example. Maybe they were dragging their foot, like a brace fitting that way. So why physical therapy? According to the National Aging Council, for those seniors over the age of 65, 1 out of 3 of them, and then those seniors over the age of 80, 1 out of 2 of them will fall within at least one time this year. And many of those actually end up in a very an injurious fall. So they will have an injury and then subsequently have to go to the hospital. And unfortunately, about 70% sometimes will end up having to go to a nursing home. So that's really scary facts, right? That's one of our main jobs, to help you be at less risk for falling. A PT can also help you prevent falls by designing an individualized program. So everyone that we get to see here, everyone's different, right? Everyone's unique. We don't have a set plan that we always do for each person that we get to see. So we would come in, or you would come in to see us, and then we would be able to get to know you, see what those concerns are that we talked about, and develop a plan that's specifically designed for you. And then focus on the strength, flexibility, balance, endurance, those type of things to help you reach your goals for whatever activities you were talking about to us before. So in particular, for the individuals that we get to see here that have neurodegenerative diseases, the physical therapy benefits that they will hopefully achieve would be reducing their risk for falls, improving mobility, improve the ease of performing daily activities, being able to do that with less assistance from their caregiver or just ease by them doing them alone, improve strength, coordination, and flexibility, increase the independence and self-confidence with those activities, enhance their quality of life and well-being, and then also learn that home exercise program to help promote further improvement even after you graduate from physical therapy. So, what we do in physical therapy is exercise, right? So why is it important to participate in a physical activity exercise program? One, it reduces the risk of cardiovascular disease. It reduces type 2 diabetes, reduces the risk of some types of cancers. It slows disease progression, decreases cholesterol, and strengthens bone density. It also helps with weight control, decreasing blood pressure. You can see there's a big long list here. Improves self-confidence, decreases stress, improves your mood, improves balance, slows the age process. There's a lot of different things here that exercise can help out with. And each individual person will benefit from it in individual ways. But our motto here is health is wealth, and whatever is good for the heart is good for the brain. So if you're participating in an aerobic exercise program, and we know that it's going to help your heart be healthy, it's also going to help your brain too. So keep that motto in mind. Health is wealth, right? That's my motivational speaker too for you. Okay. So a good question is, how much exercise does it take to help you be healthy? First, the National Institutes of Health says 150 minutes a week of 30 minutes of exercise, that's aerobic exercise, 5 times a week. Now aerobic exercise, which we'll talk about it here in a little bit more, but that's like walking, swimming, dancing, biking, anything that's going to get your heart rate up that way, where you're breathing in a lot of oxygen, you're getting your heart rate up for a sustained period of time. Now the American Heart Association also recommends that you do at least 10-minute bouts. That's where the benefit is, okay? Now at first, if you're not used to doing an aerobic program, you may not be able to achieve that 10 minutes at first. That's okay. You start slow, and under the guidance of a physical therapist, we can make sure that we'll be monitoring your heart rate and your blood pressure and your oxygen and how hard you're working, and then you'll be able to progress a little bit more and more until you're able to get that 10 minutes, and then hopefully be able to get that 30 minutes of a recommended aerobic exercise, okay? And then types of exercise there, yep, and then here it is again. What's good for your heart is good for your brain. So the physical therapy services that we provide here would be an evaluation and assessment. So the first time when you come in, we'll get to know you, we'll ask you questions about what difficulties that you might be having, and ask about your goals. We also do gait training, so to work on your walking to help with different walking impairments that you might have. We'll do neuromuscular re-ed, which is basically balance training, okay? Therapeutic activities and exercise, so we'll teach you that strengthening program. We'll also work on functional activities, getting in and out of bed, on and off chairs, in and out of the car, those type of activities. Manual therapy, which is way more than massage, okay? Way more than massage. We do, depending on what injury that you might have, you might do like what we call joint mobilizations, where we'll work on your shoulder, your joints, if you have pain or maybe some lacking of range of motion. We'll also work on tension in the muscles to help out with relaxing pain or tension in that way. And then we can also do power mobility and the brace fitting that we talked about a little bit before. So within an evaluation, we'll address your strength, your range of motion, your coordination, walking endurance, your walking speed, balance testing, and then we might, depending on how your balance testing is, we might even be able to try this really cool machine, a NeuroCalm, which we have in our other department in occupational therapy. But you might not need that depending on what tests we do. So the typical plan of care would include the evaluation, and then we might, depending on how your testing goes and what your goals are, we might certify you for anywhere to 4 to 12 weeks, depending on what's going on. And then you might have appointments for 1 to 3 times a week. We'll teach you that valuable home exercise program to help you be independent with that and try to do that as frequent as possible, whatever we recommend and what's realistic for your daily activities. And then we'll do a reassessment every 4 weeks to assess your goals and how you're progressing through physical therapy. And then remember too, every plan is unique and individualized. So if you have a friend that's coming, even if you both have balance trouble, her plan might be very different than your plan too. So let's talk a little bit more about the activities that we do. The neuromuscular re-education, or the balance training. We might do some tasks to work on static balance, so just standing still balance. And this particular picture shows a gentleman working on single leg stands or standing on different surfaces. Now you might ask, well, why do I have to stand on those things? I don't really stand on one foot all day. Well, you actually do. When you're stepping up onto curbs or walking up and down stairs or walking faster, there's points in time where you're going to have to step only on one foot, okay? Or like when you're walking across gravel or grass or walking on uneven concrete, those type of things. And then when it's dark outside, your eyes are not necessarily, they might not be adjusted to the darkness. So when you practice your balance with your eyes closed, or when you challenge your vision by maybe moving your head side to side or looking up and down, that's going to help keep your balance stronger, even when you're just focused on one thing. Now the dynamic balance part would be maybe putting you through an obstacle course that would include a variety of different activities. Stepping over obstacles, walking over different squishy surfaces, compliant surfaces, uneven things. Maybe take it out or go outside to work on the stairs and curbs and the different types of grasses and gravel, rock. Depending on what's going on in your story, if you have a hard time walking around or maybe working in your garden outside in your backyard and you have gravel there or grass, and you have to do a lot of kneeling to bend down to pick up weeds or something, that might be something that we would need to practice. So for the balance testing, the NeuroCalm, which is that big machine I was showing you in a picture, this would be an assessment that what we would do. Now, not everybody needs this type of assessment, but it's a really cool machine. What we do is assess your balance and your 3 different balance systems, your eyes, your inner ear, and your feet, the sensation. And this test gives us 6 different options that tests all those things. With your eyes closed, your eyes open, the floor moves, or the wall might move, or then a combination of all 3 of those. And this test would give us how you do in those different situations, which then would help us develop an even better plan for you to practice your balance. And then we would reassess that in about 4 weeks or so, okay? But we can also do those with the other tests that we do as well. You don't necessarily just need that machine, but it's a really cool machine, worth talking about. We also work on gait training, so walking. We'll help you if you need to use an assistive device, or maybe you're using a walker now and you'd like to get back to using a cane, or maybe you'd like to be able to not have to use anything. We would not only make sure that it's the right size and fit for you and know how to use it properly and safely, but hopefully be able to help you get back to achieving your goals of not having to use it quite as much. We'll work on the treadmill, and then we'll also do walking activities over ground as well. And these are some examples of some different types of gait training that we might do. We have a couple of different devices upstairs as well. We have the Biodex, which is a combination of this picture and this picture, which we could actually put you in a harness if you had some balance impairments to help you feel confident and safe. And then we could even unweight you if it was absolutely needed, unweight you to kind of help advance your legs while you're walking. And then here's a physical therapist working with someone with a walker. Here's someone helping advance their leg too. They might have some leg weakness here. And then we also have this machine and another machine like it. It's a little tiny machine there. It's called the Bioness, and that helps lift your toe. Some individuals, maybe after a stroke or maybe have had MS, where they have some weakness in the shin muscles that help lift the toe, this device might be appropriate for them. The other device that might be appropriate for them would be that top left-hand corner one. That's called an AFO, an ankle foot orthosis. So that might be appropriate for them too, but that's what we would take a look at during our gait training. Okay, this is a really neat body weight support harness system that we just got. It's called the Solo Step. It actually was just installed a couple weeks ago, and it's really, really neat. So you can do all sorts of obstacle training, that neuromuscular rehab, that balance training. We're working on gait training as well, just like this physical therapist and just gentleman's doing here. You can use it for all sorts of different types of activities, all sorts of different types of people. You see, this particular gentleman has 2 prostheses here for his legs. He had 2 amputations. So he's working on balance activities there. But it's a really wonderful system, and it can help you be more safe, feel safer, and feel more confident. Of course, the physical therapist would always be with you during this time. We wouldn't just let you go, okay? But you would be practicing your balance. We would work on all sorts of different activities, maybe on different surfaces and such that are a little bit higher level balance challenge. Okay, so the therapeutic exercise, which is the strengthening, flexibility, doing aerobic exercise and such, these are some pictures of some different activities that we would teach you, that we would do. So we might do some arm strengthening, some leg strengthening exercises, work on your core to help out with strengthening your abdominal muscles and your back. We might also work on a little bit more aerobic exercise there too, like this lady is doing. So we would teach you a home exercise program. We also give out TheraBand, some of that resistance band too, or maybe it would be more appropriate to use ankle weights or dumbbells, whatever you might have available or wouldn't mind going to purchase too. But we would teach you an assortment of exercises that you could start doing as part of your program at home. Okay, so cardiovascular fitness, that's that aerobic exercise that we were talking about. Now, this is going to be different for everybody. Some people may more enjoy going out for walks, or some people might enjoy going to the pool to go swimming or go walking in the pool. Some people might enjoy using a bike, such as this, the New Step. We have a couple of these machines upstairs. Or some people might not necessarily like to do that and would like to do more like dancing or like tennis, other types of activities like that. That's okay, as long as you're getting your heart rate up. That's the most important part, your heart rate up or your exertion. Now, I have a chart here, and it's kind of hard to see because y'all are far away, but let me describe it. This is a chart from 0 to 10, and 0 would be how, this chart basically asks, how hard are you working, okay? 0 would be at rest, and 10 would be, I'm working extremely hard. Now, when you're first starting your program, it would be more appropriate that you were feeling comfortable and confident and safe and not breathing too heavy, not feeling too uncomfortable. But as you get going and under the guidance of a physical therapist, you want to work at level 6 to level 8, so 60 to 80%. And that actually matches up really well with where you want to be for your heart rate. And we would teach you how to check your heart rate and how to use this scale appropriately too. For your target heart rate zone, you want to be between 60% to 80% of how hard you're working as well, based on your heart rate. And you can calculate that pretty easily with your birthday and your age. Okay? So we would teach you how to use that as well. Now you can also see that this person has a pedometer here too. That might be a good way to monitor how hard you're, or how many steps you're getting daily activities. I also have a chart here that we could use too to help you educate you on how many steps that you want to get during the day. So let's say, this is quite a range here, but let's say for a woman aged 60 to 94, you actually want to get at least 7,000 steps per day, but it has quite a range of even 3,000 plus or minus steps. Now, if you only do 7,000 steps per day based on physical activity level, that means it's actually going to put you at a low active, okay? So for active, you want to get about 10,000 steps per day. But based on your individual person and what you have going on, 10,000 steps may not be realistic for you. For example, someone after a total knee, or who may have had total knee or really bad arthritis, it might be more appropriate for them to do 4,000 steps per day, but depending on what type of aerobic exercise as well. It may not be appropriate for them to do tennis or a higher impact activity. It might be more walking in the water or do lower level walking. Okay, so that's what we would help you out with as well. All right, stretching is something that's always left out, it seems though, but it's really important. Now, on your first day, we're not going to make you do what this lady is, okay? Maybe not even on graduation day. That's just quite a picture. I think I use that in pretty much all my pictures because it's just quite amazing there. But we would teach you how to do stretches that you could do on your own or do stretches with a partner, okay? It's really important to make sure you keep those muscles flexible because poor flexibility can actually lead to back pain or leg pain, arm pain, and different other types of orthopedic impairments as well. So if you stay flexible, that can help out relieve pain too. I did mention a little bit about power mobility evaluations. So the power mobility is to help increase independence with home and community mobility. You might be able to, you would come here and let us know what your concerns are, and we would assess you saying, okay, you know, I'm having a hard time with my activity tolerance, my endurance. I'm just having a hard time being able to get out in the community, whether it's related to fatigue or muscle pain, whatever it might be. So it might be appropriate for you to be able to get a power chair, such as this, or a scooter, as that one there on the left-hand or the right-hand side. This power chair here actually has different options. You might be appropriate to get a tilt one to help you with relieving pressure. So some people might not be able to shift their weight quite as well, and this seating option would give you a little bit more cushion to help prevent pressure sores. It might be a little bit better for you, all sorts of different reasons. You can do all sorts of different fittings on there. Driving it, depending on how you need to, there's a joystick, or maybe even using the headrest to help you drive. And you would do this with a physical therapist or an occupational therapist too. And the same thing with the scooter. It's a little bit less advanced there, but the scooter could help you get out and get in the community a lot more. So who do we see here at the clinic? We serve all these people with memory loss, Alzheimer's disease, frontotemporal dementia, MS, Parkinson's disease, Lewy body dementia, Huntington's disease, and multiple system atrophy, and anyone that might kind of fall anywhere in between in those ranges that is a patient of one of our doctors upstairs. We'd be more than happy to help serve you. So let's talk a little bit about what physical therapy can do for those individuals. For Alzheimer's disease, or anyone with memory loss, it's really important that you focus on a couple different things. First, for exercise, aerobic exercise has been proven to help with cognitive impairment. It has been proven to help with short-term memory, okay, help slow the progression down. So working on an appropriate aerobic exercise program is going to be really important for that individual. Also, functional training. Somebody with memory loss may not be able to do a couple different activities, but they may be able to use certain types of their memory, called implicit memory, to help them do those activities. So if I said, you know, maybe you're having a hard time doing a specific activity, and I gave you these different type of steps, Well, they might not be able to follow you, understand you, giving them so many different steps to do that activity, but you could teach them with the PT. You could teach the caregiver how to use different cues to help them make it a little bit easier for them to understand to do. Okay? We'd also work on caregiver education and other things, such as maybe developing a bathroom schedule. Maybe that individual might be having more problems with incontinence. We could help out with that. It might be related to the fact that they might not be able to understand when they need to use the restroom, or maybe it's a functional issue, just not being able to get there quick enough, okay, or safe enough. We could help you with a daily planner and a routine, working on your schedule, doing other types of things, working on repetition and memory to help out with. Now, occupational therapy does a lot of this as well too, the cognitive rehab. So it might even be more appropriate though as well with certain things to go see an occupational therapist, which a physical therapist can give you a referral for that as well too. Now for someone with Huntington's disease, you want to work on aerobic exercise as well, but also strengthening too, and balance. This individual is going to have a little bit more balance concern in a way because of the abnormal movements that they might experience. So you're going to want to make sure that we work on what we call reactive balance strategies. Okay? That would include working on the balance and core strengthening, but then also it might be more appropriate to do some home modifications to make sure that when they're up and walking, that they don't hit anything that would cause an injury. Okay? And then sometimes it might be appropriate for them to have a wheelchair based on their balance as the disease unfortunately progresses. So we would do a wheelchair training and evaluation. Now for someone with MS, aerobic training, strengthening, and stretching are all really important, and the research says that a combination of all those three things with balance training is most important. But you really want to focus on energy conservation activities. Sometimes people experience a lot of fatigue with MS and a lot of heat sensitivity. So we're going to want to educate them on how to to be able to do these activities, but not get their body temperature up too high, and then also to be able to do activities but not make them wear themselves out too soon. And then I mentioned a little bit too about the Bioness and the Walk Aid. These are those toe lifting machines that can help with walking. We have both of those here available, so we can do the gait training on that as well. And then we have this device here. It's called the Hip Flexor Assist device. And that helps specifically for people that have the marching muscle weakness right here at your hip. If you have a hard time lifting that hip muscle, then it would help out with that, as well as lifting the toe there too. Okay? Now for Parkinson's disease, we know with Parkinson's disease it makes you want to move smaller, not being able to move in a normal amplitude, normal size of movement, and be really stiff. So with Parkinson's disease, the research says to work on big movements, to move large, and being able to incorporate those big movements through all your functional and walking activities. We would work on those, balance training, and also compensatory strategies, which would mean being able to use different balance strategies to help you catch your balance quick, like taking a step so that you prevent a fall. We would also work on unfreezing techniques, so maybe that individual with Parkinson's might have a lot of freezing that might occur with different types of environmental positions. So if they're like walking in a small space, maybe in their closet, or walking into an elevator, they might experience some freezing. So we would work on techniques like that to help them understand how to move out of that so freezing doesn't happen quite as much, or not at all. These are just two great websites on YouTube that kind of explain a little bit more in detail what the big training is. And then also, they also have big training for speech therapy, which is called LSVT Loud. And this is a great video of a woman going through the Loud training with a speech therapist. And again, too, on that initial evaluation, the physical the physical therapist could also make a recommendation to the doctor to say, I think speech therapy would be important for you too. Okay? So there's a lot of research on why exercise is important. And I mentioned a little bit to you earlier before, but a higher level of physical activity reduces the risk for Alzheimer's disease. It helps it helps for those people that are more physically active are less likely to experience a cognitive decline, or if they already have a cognitive impairment, can help slow down the progression. And increased cardiorespiratory fitness or cardiovascular fitness has reduced brain atrophy, which is making it worse, okay, making it smaller. Lower levels of regular exercise have been associated with higher functional limitations, so making physical activity, daily physical activity and functional activity things a lot harder for you. Exercise can help maintain function for people with Huntington's disease, Parkinson's disease. All of these people can help out with your daily activities just by doing regular exercise. And early engagement and participation in physical activity and physical therapy can help you be on that road to success even sooner. Regular exercise has also been proven to help with flexibility, improve your posture, and make overall movement easier. So there's a lot of things that physical activity has been proven to help out with. So a physical therapist might also give referrals to other types of healthcare professionals. Those might be, if you come to us, we're an outpatient clinic. So it might not be appropriate for that individual who's coming to be in outpatient therapy. Maybe it would be more important for them or more appropriate for them to be in home health. So if they have a harder time getting to the clinic, if they unfortunately have more impairments that would make it more successful for them to do training at home, it would be more appropriate for them maybe to do home health. Or maybe skilled nursing, where they might need more assistance, more time for rehab, like an inpatient rehab, where you would do more physical therapy and occupational therapy possibly, and speech therapy possibly for more hours throughout the day to help you get better quicker. We would do referrals for speech therapists, occupational therapists like we have here, the orthotists and prosthetists, which would help with the bracing or possibly help if you've had an amputation, social services. Maybe if someone is experiencing depression or having some trouble at home or having some trouble in their living environment, many different reasons. Also with caregiver support and such. Family care physicians or primary care physicians. Maybe it's important because your blood pressure, you're having some trouble with your blood pressure, which we would take every day and during exercise. So maybe it's important that you go and you talk to your doctor about your medications or your issues with your blood pressure and such. We also do referrals to Medicare or medical equipment suppliers. So if we were doing gait training and we noticed that your walker wasn't fitting you appropriately, or the cane, or maybe you needed a power chair, we would set up that evaluation. And other vendors like the Bioness and the Walk Aid people that help with the toe lifting equipment. So for reasons for physical therapy to go, if you even think that you have a fear of falling or decreased confidence with your activities, your daily activities, there's an issue there. Needs to get to the bottom of it, right? So be an advocate for yourself and when you go to your doctor, talk to them about these things. And hopefully you will feel confident in mentioning, hey, maybe I need to address these things with somebody. It might be appropriate for me to go to physical therapy. Fortunately, in Nevada, it's a direct access state. So that means that you could go to a physical therapy clinic and get an evaluation, even without the referral from the doctor. However, many insurances require you to need to get that referral from the doctor. So I'd go to your doctor, talk to them about it, get that referral, and go see the physical therapist so that you can address that fear of falling and the decreased confidence with your activities. Also, if you notice that yourself or maybe a friend or family member is using the walls more or the furniture for balance, oh no, I haven't fallen, but I just seem to have to require the counter a little bit more when I'm walking across the kitchen, something like that. difficulty getting out of chairs, out of your bed, or out of the car. That could be related to strength in your legs or balance. If you're having more shortness of breath or fatigue when you're walking, and an inability to do functional activities or physical activities that you enjoy. Maybe you're having back pain and you're not able to do any more bowling or not be able to do golfing anymore. Or maybe you just recently went to the doctor and they told you that you had a condition. You have so-and-so. Maybe it was a neurodegenerative disease or an orthopedic condition. Then that might be appropriate for you to go see that physical therapist. So you can jump on it right then and there and kind of help you be more as functional and as independent as possible. Or maybe you have a lot of pain. Whether it's neuropathic pain or musculoskeletal pain, we can help you try to decrease that pain or at least help you with different types of activities that you can do on your own to help relax the pain too, so that you can do more activities on your own with less pain. Now, there's a lot of different physical therapists out there. This is a great website. It's sponsored by the American Physical Therapy Association, or the APTA, and it's called Find a PT. You can Google Find a PT or use this website here that I provided for you, and you can list on that database whether you think you might need an orthopedic physical therapist, so someone that works mainly with joints and muscles, maybe a neurological physical therapist or a geriatric physical therapist like what we have here to work more on the balance or the neurological conditions. And then, or a pediatric physical therapist. Maybe you need to find one for your child, for your granddaughter or grandson, or you have a family member that needs one for a younger child. Pediatric physical therapist would be appropriate. And then when you find that, they'll actually include the name and the address and the phone number so that you can look that up and see if that would be appropriate for you to go to them. And then, of course, you'd want to get that prescription from the doctor to help set that up appointment. Okay, so in general, physical therapy can really do a lot for you. I know I'm a physical therapist, so I'm here and I'm kind of biased, but our ultimate goal is to really help you get back to the activities that you were doing before whatever this condition happened, right? For your family member or your loved one, or maybe even yourself. We want you to be as independent as possible and safe and falls free, to be able to do that as long as possible. So that's really our number one goal. And we want to work with your goals so that you can do that, okay? We've got a bunch of different resources here and a lot of references as well. So with that in mind, does anybody have any questions? Yes, ma'am. Yes, please.
In starting up some of these exercises, I get cramps in my legs. What are some of the secrets to get the cramps out of your legs?
Mm-hmm. So she asked with a lot of exercise that she can often get cramps in her legs. So she wants to know what she can do to kind of help those cramps not happen as much. So cramping can be caused by a number of different reasons. It could be that you're dehydrated. It could be that your electrolytes are off. Maybe you need more potassium in your diet. It could be that your muscles are just so tight. Maybe you're not doing as much activity as you need to. Or maybe you just need to do some stretches more frequently throughout the day. So being able to talk with a therapist about kind of what's going on would be able to get down to that. But basically probably trying to stay as hydrated as possible and then just doing some stretches to help relax those muscles a little bit more frequently throughout the day should help out with that. Mm-hmm. But there are a number of reasons why you could have cramping. Mm-hmm. Good question. Yes, ma'am.
I've heard for at least 5 years that there's been legislation in front of Congress to get Medicare to pay for maintenance for people with neuro diseases, or to pay for more benefits. And I know like Cleveland Clinic and other physical therapy companies have had lobbies there. Have you heard anything new about what's happening with Medicare and benefits?
Yeah, so she asked, what's the status on Medicare and doing maintenance therapy? So right now, and for many years, there's been a cap on Medicare. So, and unfortunately, it's been increasing every year so that you can have a little bit more money in that pot of funds to be able to do therapy. Now, for For the Medicare, it's combined, physical therapy is combined with speech therapy. So let's say someone after a stroke, they might need physical therapy and to work on their speech. Unfortunately, therapy comes out of that one pot. So if you use one more than the other, you're going to get through it a lot quicker. Now, occupational therapy is separate, okay? But now she's also asking, no, if you go through therapy and you use all your funds and it's only, you know, mid-year, what are you going to do for the rest of the year, right? There is a program that they've been lobbying for, which was to be able to allow individuals with certain conditions, neurodegenerative diseases, to continue to come as part of a maintenance program. And the idea is to help them stay as functionally as possible throughout the whole year. So in this case, in something like what we do here, is we might see you for a couple months, maybe a month or 2 or 3 months, and then we would, and through that process, we would be teaching you and your caregiver that home exercise program. And so then you would graduate, you do your exercise program for a period of time, maybe a month to 3 months, and then you would come back and we would do a reassessment and see how you're doing. If you were doing well and still at your same goals as you had before and your same functional performance as you had before when you graduated, then you would continue your home exercise program. Or then maybe you would come back and then we would do a refresher, do more balance, do more aerobic, do more walking training, those type of things, depending on what the tests and what you had indicated that you have trouble with. So that would be, and you would do that throughout the year. So that would be more of the maintenance program. And they do allow that now. We just have to, we just have to document as such the reasons why that individual might need it. Mm-hmm. Yeah, but it's not available for every certain type of condition, unfortunately. It would just depend. Good question. Any other questions? Yes, sir.
You mentioned about the hip flexors, that you call it marching muscle, what?
Mm-hmm.
What was the term you used?
Yeah, so this,
marching muscle?
mm-hmm. It's the hip flexor muscle. It's right at your pocket, the one that helps you lift your knee up like that. Mm-hmm. That specific device, the hip flexor assist device, is designed to help lift the leg in that way. And then it's also attached down to your shoe, so it can help, in a way, lift the foot up too, for like stepping up onto things or even just taking a step when you're walking.
But there's exercises you can do to strengthen that area?
Right, exactly. Standing marching exercises, laying down with a straight leg, lifting up your leg, all sorts of different things that you could do. Mm-hmm.
Can I ask
Oh,
another question?
sure. Did you have a...
Yeah, just, you said you can go into a PT and for evaluation. What would be the cost of that if you weren't under a medical plan?
If you weren't under a medical plan? So yes. So he asked, what would be the cost of an evaluation if you were going to a physical therapist, whether you had insurance or not? It would depend on the company that you go to see and the facility that you're at, truly. And then every insurance company is also different too, depending on what you have, depending on how much they will pay. Medicare will pay 80%, and then you typically would have a secondary to cover the 20%. Mm-hmm. So it just truly depends. And certain companies have a cash pay where you would only pay a certain amount. Maybe you wouldn't pay the full amount, but it just depends. I would venture to say in a full evaluation, with education might be around $100. Yeah, but with that in mind, I don't want that to deter anybody from going to physical therapy. You know, like for us, we have certain programs that might be available for that person. We would rather be able to provide a service for you that you need and be able to try to find a way that you could get that service. Or if you weren't able to get it here, then try to find somewhere that you could get that service rather than you not being able to get it at all.
Right, so it's just not the evaluation that you're interested in, it's how do we correct the situation?
Right. The evaluation is one of the most important parts of care because we are getting to know you and what your concerns are. You know, and if we weren't able to do that as well, then the time together wouldn't be quite as beneficial.
Okay.
Mm-hmm.
Thanks.
Good question. Yes, Marcia.
I had never heard the disease, Lewy disease.
Lewy body disease
Yeah,
or
what
dementia with Lewy bodies?
Yeah, what is that?
It's similar to Parkinson's disease. It's similar, but very different. So this in particular, you might have more cognitive impairment with it. You may or may not. But they may also present as someone with Parkinson's disease. Maybe have some shuffling. The posture might be impaired, bending over. Rigidity, so stiffness through their body. Yep. She had asked why Lewy body was, what Lewy body disease was, or dementia with Lewy bodies. Yes, ma'am.
We have a friend with Lewy body disease, and he's a patient here. The beginning symptoms were more like Alzheimer's, and they felt he had Alzheimer's, and then he developed the symptoms that are Parkinson's.
Right, right. So she mentioned that she has a...
Hard to diagnose.
Right.
It is harder to diagnose.
She mentioned that she has a friend that has dementia with Lewy bodies, and they presented more with like someone like Alzheimer's disease. So that's that cognitive impairment that I was telling you about. But like I was saying, everybody is different, right? And then that's why you would go see the neurologist. But even if they hadn't seen the neurologist, I didn't know, you know, a physical therapist, an occupational therapist could pick up on these things, on these concerns. And during the time together, they would then make that appropriate referral to go see a neurologist based on, you know, their impairments and how they're presenting. Yes. Does anybody else have any questions at the remote sites? Be glad to answer any.
No, thanks. Good job.
All right, thanks. Appreciate it. Well, I hope that answered a lot of your questions about physical therapy and what we have here at the Cleveland Clinic. Please let me know. You can send me an email or just reach out to our department manager, Jen Nash, and we'd be more than happy to answer any questions. Fortunately, here we have occupational therapy as well in our rehab department, so we have a lot of great resources to offer you and any of your friends and family. So please give us a call if you have any questions. Thanks so much.
Thank you.